All right, guys, it's 2 o'clock. We're going to start the webinar. This webinar is being recorded and will be posted on social media and in our website. We will also share the link by email with those who are attending the webinar today. I want to welcome everybody to our second webinar of this year's NLAAD campaign, the U equals U message and movement. But before going ahead with the webinar, I wanted to remind you about NLAAD happening on October 15th. We already launched the campaign a few weeks ago. We have sent posters by mail to every partner participating in the campaign this year, and also to those ones who have participated in previous years. If you would like posters, please email me and let me know. My contact info is on the slide. You can also call me on the phone if you want. Um, Also, for those ones who are in New York City, an invitation has been sent out today for the NLAAD press conference that is happening next week at the steps of the New York City City Hall, October 10 at 11 in the morning. So please join us, bring your banners, and help us raise awareness about the impact of the HIV epidemic in the Latino community in New York City and the country. Um, Finally, and before introducing our presenter today, I'd like to remind everyone who is hosting an NLAAD event or would like to host an NLAAD event to register it in our website, www.nlaad.org. In our main menu, you can see the registration link that will open a form to fill to register the event. The form is something like this. You have a area where you will fill the information about the event. It's longer than this, of course. This is just a part of it. And here you can also request HIV tests if you need them, but you will have to have a clear waiver number to be associated with a doctor or an organization that has it. Um, at this moment, we have already reached the maximum numbers of requests for OraSure, and the only option left for tests is the one shown in the slide, which is H-INSTI by Biolytics, HIV-1 and HIV-2 rapid antibody test, box, a package of 50 tests, one package, 25 are free, and 25 will require payment of from your organization, with a maximum of $274, which is a very reduced price for INSTI biolytical test. And you will be invoiced directly by Biolytical. We don't have to, we, Latino Commissioners, will not do that transaction. Um, so if you have any questions about it, please contact me directly, or you can call me on the phone. So now let me introduce you Murray Penner. Murray is the Executive Director for North America of the Prevention Access Campaign, the Undetectable and Transmittable Campaign. Murray served as Executive Director at NASTAD from 2015 to 2018 and served as NASTAD's Deputy Executive Director and Director of the AIDS Care and Treatment Program from 2001 to 2015. While serving as Executive Director at NASTAD, Murray signed on NASTAD to U equals U shortly after launch as the first national organization in the United States, setting the tone for other national organizations to follow. Prior to joining NASTAD in 2001, he served as a planning coordinator for the Fort Worth, Texas Ryan White Planning Council and previously as an administrator with the Fort Worth and Oklahoma City YMCA. Murray has strong expertise and experience in HIV and hepatitis treatment, the Ryan White program and AIDS Drug Assistance Program, ADAP, as well as drug pricing. He also currently serves on the boards of the AIDS Treatment Activist Coalition, ATAC, and Harbor Path and serves on PAC's funding task force. Murray received his bachelor's degree in social work from Bethel College in Newton, Kansas. He has a strong personal interest in helping people living with HIV achieve sexual health and well-being and reducing HIV stigma and shame. So, Murray, you can start the webinar. Thank you for your collaboration and support to NLAAD. You can share your screen.
All right. Luis, thank you so much. I'm going to get this going here, hopefully. Can everyone see okay? Luis, everything look good?
Yep.
Excellent. So thank you to the Latino Commission on AIDS, Luis, for your invitation for us to present this very, very important message about U equals U. I've been with the Prevention Access Campaign since May of this year and am just really, really gotten pumped up and excited about the opportunities that are in front of us to move this forward in a way that helps us first help people living with HIV with a very, very important message and foundation, but also to prevent new infections and help move us towards ending the epidemic. Just to give you a little bit of background before I get started here, I'm a white cisgender male with a lot of privilege that really has enabled me to get to and sustain an undetectable viral load as someone who's been living with HIV since 1986. I want to acknowledge that up front because I think it's really important to remember that not everyone has access to treatment, and clearly as part of what we do, and you'll hear this throughout my presentation, we want to encourage uptake of treatment and the use of this important message. I really think it's important for me to be able to leverage my privilege to help others achieve what I've been so fortunate to achieve. So I wanted to state that up front. Whoops, sorry about that. Okay, so just a little bit of an outline about today's webinar. I'm going to talk a little bit about what U equals U is, provide you some history of the U equals U campaign, talk about the importance of U equals U and providers, and communicating about U equals U, and then just give you a few opportunities and suggestions as to how you can join and amplify the U equals U movement. And hopefully, if I can move through these slides, which there are a lot of them, but I'm going to move through fairly quickly, we'll have some time for questions and answers after I finish. So just the obvious, what is U equals U? Undetectable equals untransmittable. In other words, people living with HIV who are on treatment and have an undetectable viral load cannot or do not transmit HIV to their sexual partners. So that is what U equals U is in the simplest of terms. I'm going to call on some experts here, and hopefully you'll be able to hear the sound for this to help explain U equals U. These are experts in the field. They're people living with HIV and others, and I'll move through these fairly quickly. The first one is Dina Bonds, who provided this opening at a plenary in AIDS 2018, the international conference in Amsterdam last year.
Lastly, we need the undetectable is untransmittable or U is U message to become standard knowledge worldwide. It needs to sound louder every day, as this eases the burden of stigma and self-stigma of people living with HIV. It will save lives. It will reduce suicides and murders on trans sex workers especially.
All right, and some exciting news in our field. Many of you have probably seen this. Jonathan Van Ness, one of the Fab Five on Queer Eye, just recently, actually last week, came out with his HIV status as he opened his book tour, and he provided this information on Jimmy Kimmel Live just a couple of nights ago.
And there's been so many studies, the most recent one, which was by the National Institutes of Health, led by Dr. Anthony Fauci, and it followed like a lot of serodiscordant couples, which means like one's negative, one's positive, for about 10 years. And not one transmission in the study was reported.
If it's undetectable, if you keep it low, then it's not transmittable.
Well, yeah, so undetectable equals untransmittable.
Right.
And that has been backed up by a lot of studies. And basically, when you're HIV positive, you can have access to this, well, you get access to this medication and you become undetectable. And then you can really live a gorgeous, normal life, like 50 to 75.
I love that. Live a gorgeous life, and that's what this is about. And then lastly, we're going to hear just a clip from Chloe Orkin, who's the chair of the British HIV Association, talking with Gareth Thomas, who is a rugby player in Wales, who recently also came out about his HIV status. And she's talking to Gareth in a BBC clip here about what U equals U is. And it's a little bit hard to hear, but there is some subtitles, so you should be able to follow.
The most important thing I can say is that in the UK, people with HIV who are diagnosed early have the same life expectancy as people who don't have it. But our challenge is to make that a healthy life, not just physically, but mentally. What's happened recently is amazing research, which our unit was part of, which is doing research to see if people who are on treatment and the level of their virus is what we call undetectable, so can't be measured, whether they can pass it on when they have sex with their partner without a condom. And what's been shown is that in hundreds of thousands of sex acts, if the virus is undetectable, it cannot be passed on. And that is what we call undetectable equals untransmittable, U equals U. So people can believe and let go of that sense that they are somehow infectious or can harm other people. And sometimes when I tell people U equals U, they cry. And I see people getting well. And I see people having children, young women having babies. And I see people getting their lives back.
That was a Martin Luther King speech. So what you say U equals U, does that also account for maybe friends you're with or parents or close relatives as far as sharing a cup or tending to a wound, or other things that other people in society still would fear if they knew you had HIV?
Absolutely. You cannot pass it on by hugging, kissing, touching, sharing plates, any of those methods that you've talked about. And the reality is the trials have shown 0 transmissions. There is 0 risk of passing it on. And our responsibility as scientists, as doctors, as healthcare professionals is to keep telling the truth, because there are no public health campaigns now from the government saying U equals U, you can't pass it on. There were the campaigns which were necessary in the 80s saying be careful, use condoms, you could die, but there's never been anything since then saying everyone is safe, stand down, there's no risk. And when people are brave and are prepared to speak on camera, it's an enormous help. I cannot tell you what it will mean to people, the fact that you're doing what you're doing. We're all behind you.
Thank you.
You know, because what you've done, what you're doing is important to every person that I see. It will mean something to the people that I look after.
Okay. I just get scared. I just get scared, that's all.
So I think that explains it far better than I could, but let's just talk a little bit about sort of that defining moment in history. Many of us remember back in 1996 when we learned that the effective treatment, the antiretrovirals, would save our lives. Now we know it means we can't pass on HIV to our sexual partners, which is just huge. So why is U equals U a game changer? I think it's kind of obvious, but it transforms social, sexual, and reproductive lives. It obviously dismantles HIV stigma. It provides the opportunity to encourage HIV testing and adds an incentive to start and stay on treatment and stay connected to care. And we'll talk about that a little bit later as well. But it also, lastly, provides a strong public health argument for us to eliminate barriers to access to care. So it really does provide the argument about we need universal access to treatments and care for people living with HIV. One person I've heard lately has said, invest in people with HIV, because that is what will eliminate this disease in terms of new transmissions. I have to say that when I was diagnosed, I never imagined a time when I could love, have sex without fear. And we all know that fear is so present in the most intimate moments of our lives. And we've always been taught, or we've always heard, that we had to protect our partners from us. U equals U really takes away that fear and changes our social, sexual, and reproductive lives. U equals U also changes the way we see ourselves, the way others see us, the way we're treated in clinical settings, the way policy decisions are made about us in employment and housing, education, etc. And it means that people, like I said, are more likely to get tested, to start and stay on treatment and be engaged in healthcare for their own health as well as for the health of their partners. So it greatly improves the lives of people living with HIV, and it propels us towards the end of the epidemic. All very important aspects of U equals U. So where did U equals U come from? Many of you will recall that in the 1990s, when pregnant women who used AZT showed significantly reduced risk of transmitting HIV to their babies, that there was some promise about antiretroviral treatment and what it could do. So that was the first hints that we had that this worked. Then in 2007, Dr. Julio Montagnier talked about treatment as prevention. And we had a Swiss statement in 2008 authored by Dr. Pietro Bernoza that actually talked about no transmissions from someone who is undetectable. And so in 2016, pioneered by a community of HIV activists, researchers, and AIDS organizations, folks came together to begin to convey the science, because at the same time, we were seeing some more recent studies that were demonstrating effectiveness. Here's a summary of those studies. I'm not going to spend the time. We could spend an entire webinar on all of the scientific aspects of this, but you will see 4 important studies here: HPTN 052, the partner 1, the partner 2, and then the opposites attract studies, all of which, in which there were sex without condoms over 125,000 times. So that's a lot of sex, a lot more sex than all of us can have probably together. And if you look over on the last column, while there were some transmissions within the study, they were not linked to people who were, to partners who were HIV positive and undetectable. So that's the important part, and that's why we can conclusively state that there is 0 risk of HIV transmission when someone is undetectable. What is also important to remember is that these studies are based on sexual transmission of HIV, and so when we're talking about breast or chest feeding, U equals U does not apply. There clearly is benefit to being undetectable, so it's not to suggest that the mothers who have gotten pregnant and given birth are not benefiting from U equals U. It's just that there is not conclusive evidence that U equals U applies to breastfeeding, nor with needle sharing. I like to say on the needle sharing piece that while there is not evidence that U equals U applies to needle sharing, it still indicates that the risk is extremely low, but also people who inject needles or inject drugs or share needles have sex as well. And so the U equals U portion does apply to people who are having sex. And I think it's important to remember. There's also, we've also had some experts who have demonstrated their opinions that U equals U may apply to needle sharing, but there is no conclusive research to establish that. And I just want to make sure that that is clear. So why didn't we know about U equals U before? Well, obviously science doesn't have a publicist, or unfortunately science doesn't have a publicist. And that means that there was lack of access to accurate information. There was lack of expertise or an authority to actually pull together a conclusion on all of the research that's been done. We have a lot of paternalism and bias and prejudice and stigma that is present for people living with HIV. And there's a huge resistance to change. And so there were forces working against the U equals U message becoming widely known. And that's obviously what we're working to counter. So all people living with HIV, obviously, have a right to accurate information about their social, their sexual, and their reproductive health. They have a right to know what is happening in their bodies. And so we need the U equals U campaign in order to get this information out to people living with HIV. We also know that HIV stigma is a public health emergency. It is critical that we combat the stigma that is present, and U equals U really provides an obvious, immediate solution to attacking stigma. This is something that we like to say at Prevention Access Campaign related to U equals U. We need people to tell the truth, or we will tell it for them. So tell the truth or we'll tell it for you. All right, let's just jump into a little bit of history about the U equals U campaign. Obviously, as we were, as I mentioned earlier, when we originally were looking at these studies coming forward, we went to the researchers from the leading studies, and they didn't even realize that their groundbreaking research wasn't reaching the people it was intended to benefit. Their job is to conduct research, not to ensure that their research collectively gets out to the world. But they're compassionate and very passionate about their work. And over the course of 6 months, we at Prevention Access Campaign worked on a consensus statement with the researchers to confirm U equals U. And then we sought out pioneering and influential researchers and asked them to endorse the statement. We asked leaders in the field and public health officials to support and or endorse this consensus statement. And we started to talk to HHS, which jump-started a review process with the federal government in the United States and the community to update their definition of risk, including the CDC communications. We started to see NIH creating videos to support the campaign, and they've continued to support us really nonstop over the last 3 years. And at the same time, we were reaching out on social media and building our network, showing our force through the growing numbers of people and organizations that were really pushing this message out around the world. We saw the New York City Health Department sign on to the campaign. They were the first health department to do so. Terrence Higgins Trust in the UK, Broadway Cares, and as Luis mentioned earlier, NLAAD all signed on to the campaign very early when it came out in July of 2016. And so that has grown, the campaign has grown significantly, and I'll conclude with sort of where we're at today, but here's just an example of across the world how far the campaign has reached. In 2017, we saw more progress. Some of this is from the international conference in 2000. And then this important press conference at the IAS 2017 in Paris, and you can see very esteemed folks, Charles King from Housing Works, who was very instrumental in the early days of the U equals U campaign, signed on early as well. And of course, even the Latino Commission on AIDS was one of our very early signers. So it really took these experts coming together again to push this forward. Here's the city of Washington, or the District of Columbia, Washington, D.C., signing on to the campaign in late June of 2017. And a monumental moment, and this is one that is often cited. In fact, there was an event last night at the Capitol with AIDS United where Jesse Mylan talked about this very moment right here when Anthony Fauci at the United States Conference on AIDS in September of 2017 stood on stage and said, the science really does verify and validate U equals U. You can see that picture there. Then moving forward into later September in 2017, this was on Gay Men's HIV/AIDS Awareness Day. The CDC came out with some really important language that said there is effectively no risk of sexual transmission when on treatment and undetectable. And as I mentioned earlier, you can see a couple of shots here or you see one picture there of some advocates who were working with HHS and CDC on this language. So we were very, very pleased to see the CDC move along and indicate effectively no risk. And while effectively no risk does not say zero risk, effectively means actually, or in other words, no risk. And so we were very pleased with this language from CDC in September of 2017. And then we've seen others come out and say the same, even more bold. And these are officials within the United States government that are saying U equals U is effective. HIV cannot and will not go on to transmit the virus. U equals U is an essential component for ending the epidemic. If you're virally suppressed, you are not infectious. U equals U. So you can see that we've got support of the federal government. We've also got support around the world from governments. And I'm not going to read through all of these, but you know, in particular, the UK has been very, very strong. And I'll show another slide in a moment about the UK's work, but we see public health agencies in England being very bold about U equals U. UNAIDS, USAID, PEPFAR, FHI 360. There are many World Health, WHO, World Health organizations that have also come out very strongly in support of U equals U. And then some real important developments, which I want to call attention to. Just a couple of months ago, in July of 2019, right before the international conference in Mexico City, the CDC updated its risk assessments of various interventions to prevent transmission and published that U equals U is 100% effective for preventing sexual transmission. Clearly that means someone with an undetectable viral load who is on effective medication and maintains that viral load does not transmit the virus, 100% effective. And then later in August, the CDC came out with a letter to all of its grantees giving permission to use the U equals U terminology and encouraging the publishing and the dissemination of this important message, including endorsing the Prevention Access Campaign in our materials. So we were very, very pleased again that CDC continues to be very supportive and push this information outward. Excuse me. And then finally, Dr. Fauci, although he had already said this at the international conference this last year in Mexico City, stated unequivocally that U equals U is the foundation of being able to end the epidemic. Here's just a statement that CDC Global put forth, again, supporting U equals U. It talks about the various translations into more than 25 languages, K equals K in Vietnam, N equals N in Dutch, B equals B in Turkey, I equals I in Spanish, Italian, and Portuguese. So we've got broad CDC support. We've got support from major medical journals, and I won't go through all of these, but the Lancet in particular has been extremely important in validating and pushing out the scientific evidence about U equals U. We've got countries who are supporting U equals U. And here, as I mentioned, is some information about the UK. The UK
I can't keep ending with you walking me home, a kiss on the cheek, and then you make an excuse to leave.
I don't make excuses. All of their national organizations coming together
and I know you like me.
with outdoor advertising, marches, mainstream media.
Then I can't keep ending with you walking me home, a kiss on the cheek, and then you make an excuse to leave.
I don't make excuses.
The Federal Health Ministry, advocacy, updated treatment guidelines, et cetera, et cetera. So lots is happening in the UK. Here is some graphics from Vietnam. They're doing some amazing things as well. This is a fashion show. Fashion show.
Can't hear you. Okay.
Can you hear me now?
Yes.
Okay, great. Here is some pictures and some footage from Zambia.
With you, it goes you, we can, we la la, we nenuka, we la la, keep on fighting.
Here are students in Ireland demonstrating and showing off U equals U. There's no sound to that one. This is from Tokyo. They've got some amazing campaigns going there. There's a dance party. Bruce Richmond was able at Life Ball this last year in Vienna present about U equals U in the opening there with Conchita up on the upper right. But lots of great stuff all across the world. New Zealand has had some amazing campaigns. I like to talk about this one. They actually had this in the city center, Drop Your Load, and the free cum rags. So there's just some amazing public campaigns that are out there trying to get the word out about U equals U. And I could spend an entire day going through all of these videos and all of these campaigns that are taking place across the world. And then bringing it home, some of you may have seen this, especially if you're in the New York area. The New York State AIDS Institute, as well as New York City, have had some amazing campaigns, and I think these are the most current ones that are taking place in New York. So New York has continued to lead the way in terms of pushing out the U equals U message. Obviously, the U equals U campaign is about sharing knowledge, right? It's sharing knowledge for people living with HIV, for healthcare providers, for policymakers, and for the general public. So there's much to do. We are across the world, and in fact, the Prevention Access Campaign's U equals U campaign is now joined with 923 partners from 99 countries. This is on our website, this map, and you can actually click on these various pins and see the organizations that have actually signed on to the U equals U campaign. There are 15 state health departments and 28 local jurisdictions in the US that have signed on, as well as, you can see there, the international sign-ons that we have from Canada, Monaco, City of London, City of Paris, State of Victoria in Australia, and the City of Toronto in Canada. So just a couple of words about U equals U and providers. And I like to consider providers far more than just medical providers. It really is case managers, outreach workers, anybody who is working with people living with HIV and or just providing information out in the community as far as testing and outreach. And so I think it's important to make sure that providers are talking about U equals U. Dr. Sarah Calabrese and Dr. Kenneth Mayer published this article in The Lancet earlier this year, talking about it being inexcusable for providers to withhold the U equals U message. and that conveying benefits and risks about treatment is fundamental to a patient's decision-making. And so it really is important to, in order for patients to maximize the well-being, their well-being, that they have all the information that is necessary to make decisions. There are consequences if providers don't talk about U equals U. Obviously, telling someone they are infectious or they will transmit when they aren't is unethical and harmful. And we feel it's really almost malpractice. It is malpractice to withhold or deny life-changing information to people living with HIV about U equals U. People are going to find out about it, which then breaks the trust between providers and patients, and opportunities for those patients to improve their personal health as well as the public health are wasted. So from a provider standpoint, it's very, very important for providers to talk to their patients. This is an example of some innovative work from the HIV Medicine Association. This is a pocket card that providers can have to reference about the science, the need to tell people about HIV, and ways to actually talk to patients about U equals U. This is Dr. Allison Rogers. She was the lead author of Partner 2. I'm going to play this clip real quick because it talks about why and the importance of providers telling their patients about U equals U.
Oh, it looks like we've got one more, and it has to come from U equals U himself.
Hi, Allison. Today is marking a revolution in what it means to live with HIV. So thank you so much for your research. I have a question on behalf of the U equals U campaign. There are many providers that are still not accepting this message. They try to focus on the risk is not zero scientifically, or they focus on their patients aren't going to be adherent and they won't know that they're detectable, or they say there's a rise of STIs already, so they don't want to share this with their patients. We get every single kind of excuse. What would you say to clinicians or any other information provider who is withholding this information from people with HIV?
Yeah, and I just want to pay tribute to the U equals U campaign. It's been astonishing. I think the time for excuses are over. I think it's very, very clear that the risk is zero. So I very much think we have to promote this. I think if you're on suppressive ART, you're sexually non-infectious, and yeah, the time for excuses is over. And I again pay tribute to you and your work.
Well said. Thank you, Alison.
All right, couple of slides about how to communicate U equals U. There is a lot here. I'm going to move through it pretty quickly because I want to make sure we finish on time and give you all a few opportunities to ask questions. So obviously, language matters. We recommend first and foremost to be consistent and clear. There are ways to be clear, including can't pass it on, can't transmit, no risk, zero risk, prevents HIV, eliminates onward transmission, and effectively no risk. If you use some of the phrases on the right, it means there is still a risk to take into consideration. And as we know from the studies, if there is an undetectable viral load and someone remains on treatment, there is no chance of transmission. So the phrases on the right are ones we recommend you not say. The ones on the left are phrases to say. Really recommend being mindful of the messages that you're conveying. Otherwise, it displays a sense of risk, which then does not erase the stigma. As I've said, we've seen lots of experts saying that the risk is zero. Dr. Fauci, Carl Diefenbach from NLAAD, the chance of acquiring HIV from that person is zero. Let's be clear, zero. And the British HIV Association statement of no risk or zero risk. Attitudes also really matter, and you'd be surprised by the lengths to which people will go to confirm their pre-existing false beliefs. There's obviously many times a tendency to be overcautious, to overprotect really HIV negative people from people living with HIV, and that inadvertently just continues to perpetuate stigma, and many don't realize the impact of their words. And so again, we encourage really to be mindful of how you communicate about U equals U. Here's some examples. Don't say, I believe in U equals U, but use a condom just in case. Say instead, condoms or PrEP aren't clinically necessary to prevent HIV with U equals U, but you might want to use a condom to prevent other STDs. I think that's a real important part. Or pregnancy, if your partner is struggling with adherence, or an added emotional feeling of security and agency. There are erasers, what we call the big erasers, and these are ones that really just kind of erase the fact that U equals U. For instance, you're only as good as your last viral load. Well, if you're saying that, then you're just basically saying, well, there's nothing good here. So if you're taking your medication as prescribed and you're getting your labs done on a regular basis and you're staying in care, you don't have to worry. Don't say you never know, because you do know. We do know that if you are taking your medication regularly and have an undetectable viral load, that you do not transmit the virus. Another important part of U equals U, we really like to spend some time on this, and that's because not everybody can achieve a viral load or have the means to achieve a viral load. So we like to suggest that viral load neutrality is important. V does not equal V. In other words, your viral load does not equal your value. It is a personal decision for people to be on treatment and not a public health responsibility. All people do have options for hot and safer sex. And so condoms, and in some parts of the world, PrEP are effective choices. We also, as we've talked about already, know that structural barriers sometimes make it impossible or very difficult for people to start and stay on treatment. And again, using the public health argument to remove barriers to universal access is a means of trying to move towards viral suppression. People not only need to know how to say it, they need to see that U equals U is prioritized. So one of the things we suggest, and as I get to the end, I'll suggest some ways that agencies and you all can incorporate U equals U, but one of the things that's important is not to bury U equals U at the bottom of a web page or a publication, not where it won't be seen. So move it to the front, put it up front and into context as really important, life-changing and stigma-busting news. Use quotes from experts. We always say borrow from the experts because the experts can talk about this. And integrate U equals U into communications that you have in various subjects: stigma, treatment, access, criminalization, activism history, etc. Speaking of criminalization, this is an area that we know with many states still having really unjust HIV criminalization laws on the books. U equals U becomes part of the efforts to modernize criminalization or decriminalize HIV, if you will. It has been used as a defense in individual cases, and U equals U advocates and those who are working in criminalization or decriminalization really need some clear guidance, because there still are a lot of laws, and I think it's always important to tell people that there are disclosure laws and they vary from state to state. So you need to be mindful of those. And we could, again, spend a whole webinar just on criminalization. So what are the basics about enjoying U equals U? We like to talk about TLC, treatment, labs, and connection. And that means you get on treatment, you monitor your labs, and you stay connected to care. U equals U is synonymous with under 200 copies. We know that there are some viral load tests that go lower than that, as long as they are at 200 copies or below, which is what the studies were based on. That is synonymous with viral suppression and undetectable when we talk about undetectable. Again, a reminder that U equals U is about sex and not breastfeeding or needle sharing. U equals U obviously does not prevent other STIs or pregnancy. And so using a condom or is important to talk about when you're talking about STIs. In terms of disclosure laws, we just talked about that. U equals U might not be an exemption from that, and viral load, again, does not equate to value. So how do you, just some common sense questions. How do you know a person living with HIV is really undetectable? We talked about that treatment labs connection, the TLC. If someone is on that regimen, if you will, and there is trust about that, you can be sure that a person is undetectable and will not transmit the virus. This is a question that we often get related to viral blips. Sometimes individuals will have certain viral blips. Should a patient be concerned about that? The answer to that is no. We do see viral blips between 50 to 1,000. Those are not clinically significant to risk, and there are references for that if you are interested in it. But if they do increase over time, that's when you work with your provider to change your treatment regimen and make sure that you can maintain an undetectable viral load. Excuse me. There's often also this question that people won't understand U equals U. They might stop treatment and experience viral rebound and still believe they're undetectable. Well, it's an opportunity to educate. Obviously, medicine only works if you take it. Again, re-emphasizing the TLC is important. I've already mentioned STIs, so I won't spend much time there, but it's an opportunity, again, to educate. Let's make this about sexual wellness. And when individuals are using U equals U as their prevention method for HIV, it's important that those individuals are also being screened on a regular basis for STIs. But in educating about condoms is still an opportunity for those individuals. We know that U equals U only prevents HIV. Condoms help prevent STIs and pregnancy. And then finally, I want to hit on this point. The public health argument is really important about U equals U. It is an argument to get universal treatment and access to care, which then also prevents new infections. We often refer to this as the third U, or the universal access to care. U equals U is primarily about keeping people healthy and fighting stigma, and this argument can be made to policymakers that it also prevents new infections. So, what can you do? One, we would strongly recommend that, in particular, agencies train staff in U equals U basic science and communication to reinforce this message. It's great news, and we really want to get that news out there. Make sure that promotions are accurate and prominent and consistent. Again, as I said, not on page 4, 5, or 6. Let's make it a headline. It's a big deal, and be consistent about that to overcome some of the challenges that people throw up about U equals U. In terms of social media, repeat it daily and often, and in a way that will reach the intended population and in a way that is not stigmatizing. Put it in your website, on your website, newsletters, events, etc. Communicate very consciously, as I've mentioned. There are lots of ways to communicate U equals U. Be clear, be bold, be consistent. Leverage that U equals U public health rationale in your advocacy efforts. As I mentioned, if people don't have access to treatment, use U equals U as a way to motivate policymakers and others to increase access to treatment and care. We also ask people to speak out if you see incompetence or incorrect language or inaction. It's really important to make sure that you're speaking out when you don't see something going right. We know that there are efforts underway. For instance, the US HHS guidelines are being updated, we believe, to indicate that U equals U is an effective not only treatment, but prevention method. So we are continuing advocacy. We are speaking out as an organization when we see places that need to be improved, and we would ask all of you to do so as well. And then finally, connect to the U equals U movement. You can join as a community partner on our website. You can go to the community section and sign on to the consensus statement if you are not on already as an organization. And then we invite you to take part in social media. We use the hashtag U equals U spelled out, as you see here, U equals U, all spelled out. That's important because it allows people to follow the U equals U conversation. And so we would ask you to use U equals U in your social media as well. It really is time to redefine what it means to live with HIV. Here's another reminder about that U equals U hashtag. Use it often and always use U equals U. Contact us if you would like sample tweets. We quite often are putting sample tweets out, particularly on the Federal AIDS Policy Partnership listserv. If you don't have access to that, contact us and we can get you sample tweets and language to use in your social media. Here is another resource that we have available, thepositiveseries.org. You can go to that on our website or go to positiveseries.org and download any of these materials. They're unique, they're customizable, so you can adapt them to your agency and or your own particular situation. I do want to remind everyone also that this is a campaign that is in 99 countries, so you will see it interpreted and translated differently than U equals U. And we know that there are other ways of saying U equals U. If U equals U does not work for a particular community, the important part is to talk consistently and clearly about the undetectable status, allowing you to not transmit to your sexual partners. So if U equals U doesn't work and there's another phrase or something else that works, use that as well. Again, the importance is to communicate clearly. One of the campaigns in Great Britain is Can't Pass It On, and in Canada, Can't Pass It On is something that they have determined works for them. And so that is perfectly acceptable. In fact, we welcome reaching communities in ways that might not otherwise be reached with this important message. I'm going to conclude here with Jackquelyne Alesi from during the international conference this year. She spoke about U equals U, and this might take just a moment to load here. It's on YouTube.
U equals to U is perhaps the most inspiring recent campaign and reality in the HIV history. It brings hope to so many of us, but most importantly, it brings the message that we are not disease vectors. Listen to this and let it sink in. We are not disease vectors. We are human beings.
So, with that, I am finished. I think she sums it up far better than I could do it, but I wanted to see, we've got a few minutes, I think, for questions. So I wanted to see if anyone had questions or anything else I could answer. Luis, are you going to moderate that?
Yes, thank you very much, Murray, for all this amazing information important information that you are sharing with us today about U equals U and the things that we have to do to deliver the message to more people. It's, as you say, it's very important that we carry this message everywhere and that everybody knows and learns about U equals U and why it is important. So anybody who would like to have an answer, I'm going to go through the questions that are written here already. I'm going to read some of the questions for you, Moray.
Okay.
Let me see. Oh, what was that?
No, that's mine. I'm sorry.
Okay. Makes a comment here. Oh. Yeah. Yes. So everybody who's asking if we are going to share the presentation, yes, the webinar has been recorded and it's going to be shared by email to everybody who access today, and it's going to also be posted in social media. About it. I'm going to give it to Moray if he wants to share it as well in U equals U webpage. I'm going to put it in NLAAD webpage and social media, Facebook and Twitter, and I will again send it by email. Is there any research to support U equals U for HIV-2 as well? That's Nakia Outland asking.
You know, I'll have to get back to you on that. I don't know the answer to that. I will find out, and I don't want to tell you incorrect information, so I will get back to you on that.
Okay, Ernesto Hernandez asking, there is still a lot of people out there who ask about reinfection. I know that what I say to them, but what would you tell them?
So, you know, again, I would emphasize the fact on reinfection. That's an important, really important question. If you are undetectable, you do not transmit the virus. That's the important part. In terms of reinfection, there was a lot of hype a few years ago about a super infection and or those kinds of concerns. I think what I would say is that medication has gotten better and better over the years, and so the opportunities for reinfecting, if you will, to a resistant strain and for opportunities for new strains of HIV with resistance to develop through a reinfection have been greatly reduced. So as medication has gotten better, I think that concern is far less than what it used to be. Again, though, I would emphasize the importance of, you know, making sure that you're engaged in care, that TLC, that treatment, labs, and connection, that is an important part of U equals U, that if you are able to achieve an undetectable status, and many people do in a very short time once they start treatment, that you do not have to worry about any kind of reinfection or anything either.
Thank you. Herbacia Archer asks, how long is the process for a newly diagnosed patient to become undetectable?
Yeah, great question. You know, in the early part of the U equals U consensus statement, we talked about 6 months, and that is a very conservative estimate. We see people that can achieve an undetectable viral load in as little as 3 weeks, for instance. And so what is often, this is why that connection with the provider is so important, because it's up to a provider to help navigate when somebody is durally virally suppressed, which is really what we're talking about on an undetectable viral load. But there are some clinical guidelines. The state of New York has put out clinical guidelines that said if you achieve two consecutive undetectable viral loads at least 2 weeks apart, then you are considered virally suppressed. And so, you know, it's conceivable, to answer your question, the shortest way possible that you could get to that phase in about a month. But again, it's important to make sure that you're engaged with regular care with your doctor, to make sure that your doctor is testing regularly with you and making sure that you've achieved a couple of undetectable viral load tests.
Thank you. Pedro Coronado is asking if there is any information about U+U in Latin America, especially in Mexico. Are they promoting it?
So there are a couple of organizations in Mexico. I think we really recognize the importance of this in Latino and Latina communities. It's really important, and we haven't seen the uptake as much as we would like in certain countries. And so there is some. To answer your question in a short way, we need more. And I have to say we need more in a lot of countries, including the US. We need to be pushing this out far greater in the US. And so the other thing I would say relative to this is that if you have opportunities or you have ideas, we would love to hear those. We are constantly working on connections with partner organizations who will take this up and move it forward. We can provide technical assistance. We can provide support in terms of how to get the word out. But some countries in Latin America are not where we would like to see that. But I would also say that even where there are restrictions in where we're seeing some really oppressive governments, for instance, this message is really important for people living with HIV. So despite the fact that there may be challenges to get treatment and everything, it's important that we still get the word out and use that then as an opportunity to increase uptake of treatment and increase access to care.
Bevenan Milton from Guyana says, I'm from Guyana and serve the trans community. There is a lot of LTFU in my community. Is there any resources available to bring this campaign in my country and the Caribbean?
Again, I would encourage you to get in touch with us, and we can certainly work to connect you. One of the things that we think is really important is connecting with organizations in your country, in your region that are actually doing this work. And it's one of the ways we can help disseminate the message in countries. We can't clearly be in every country doing all of this work. We just don't have the bandwidth to do that. So please be in touch. My information was on the previous slide, and I think, Luis, you said you would include it as well. Again, my contact information, be in touch, and we can help connect you and or work to increase the work that's happening in your country.
There are two questions that are, I think, connected. Ernesto Hernandez, he says, just to confirm, U=U does not include transmission through breast milk and needle sharing. A mother can transmit HIV to a child through feeding if they are undetectable. And the other question is from Scott Solomon, is does U=U apply to blood-to-blood contact like a cat?
So great questions. Again, on the breastfeeding question, there is not conclusive research to demonstrate that U=U applies to breastfeeding and breast milk. What we do know is that the risk is greatly reduced, and there are great benefits to mothers relative to U=U. So I don't want to dismiss, on either one of those cases, I don't want to dismiss the fact that U=U is not important. It just doesn't apply to the transmission. Luis, can you repeat the second question, please?
Does U=U apply to blood-to-blood contact like a cat?
Blood-to-blood contact. U=U, because of the way the studies were conducted, they were conducted for sexual transmission. Again, I would say the same thing that I would say about breastfeeding, that the evidence indicates that it's greatly reduced, but the studies were conducted for sexual transmission.
Ricardo Jimenez, I am from Puerto Rican Culture Center, and we have comments the E=E, I=I campaign in Puerto Rico, Mexico, and Chicago. We went to Mexico 2 times for this campaign and to Puerto Rico. We had a symposium last week on the subject, just for the people asking about Mexico. Anybody? I think that's all the questions that we have. Anybody else before we finish? You can write your questions in the chat box or in the question and answer. Okay, Stephanie, she said, you mentioned HIV-B. Can you briefly explain what it is? I don't think you mentioned that.
Yeah, I don't think if I did, it was inadvertent. So wasn't talking about HIV-B.
Yeah. All right. So it is 3:05. We're going to close the webinar. Thank you very much, Murray, for all this information. And thank you, everybody, for attending the webinar today. It's been a pleasure to deliver it. And we hope to see you all again next week, especially for those who speak Spanish. We're having a webinar completely en Spanish. Un webinar completamente en español para todos aquellos que hablan español. Por favor, suscríbanse. Va a ser acerca de PrEP en español. Everything is going to be in Spanish about PrEP next week. So we hope to see you all there too. Thank you, Murray, again. You can say goodbye to your attendants.
Thank you so much. I really want to again thank the Latino Commission on AIDS. Great partners. Luis, thank you for pulling this webinar together. We greatly appreciate the partnership, and I encourage all of you, if you have further questions, please be in touch with me and or the Prevention Access Campaign, and we will work to answer your questions and help you out. So thank you, everyone.
Thank you. Goodbye, everybody.
Bye-bye.